So, good morning, everyone, and thank you to the monthly meeting for New York City VOAD, um, which, by the way, is open to anyone. So, anytime that you want to tell anyone about our monthly meetings or, forward an invite to them, we are hoping that they will be provided with some kind of information that they can use or amplify. So we're open to anyone. I am the co-chair along with Racine Drotz, who cannot be with us today. But of course, our vice chair, Zach, and other members of our board are in this meeting. So about New York City VOAD, we were founded in 1997. And we are part of a larger statewide organization or coalition of COADs and also a national one. And our organization consists of a multitude of organizations with different kinds of missions, be it faith-based, whether it be a disaster mission or be it multiple missions with the need to be involved with disaster preparedness. Um, so this month is National Preparedness Month. We all know that. And we thought that it would be a good idea to feature some of the organizations that are part of the co-ed community in New York City. And fittingly, the theme today is the power of preparedness, New York City community organizations active in disaster. Now, they can be called co-eds, they can be called community emergency networks, mutual aid organizations. They've got a bunch of names. But as the story goes, the very first community emergency response team was actually established and developed by the Los Angeles City Fire Department in 1985. They created a CERT team, which of course became a model for preparedness by community members and volunteers across the country. So that concept is further solidified after a number of major disasters across the country. And of course, the need for agencies and formal response entities to understand what exists within a community. And of course, who knows that better than the people who live in it? So, with that said, today we are featuring a few of our co-eds in New York City, and we are also featuring some of our agency partners, and we're going to begin with introducing them now. Our first presenter is Michelle Bascomb. She is the Director of Programs and Development at nonprofit Staten Island and the Managing Director of Staten Island COAG. And in this role, she is focused on strengthening the coalition's infrastructure, building cross-sector partnerships that enhance Staten Island's preparedness and response. They have mobilized partners around extreme weather, humanitarian issues, public health crisis, and while the Community Climate Corps, a parallel initiative that she oversees. Through it, she brings resources, training, and community engagement into resilience building. And she also has a background in education, nonprofit development, and civic engagement to this work, as you can imagine. And your next speaker is going to be Michelle. Michelle, welcome and thank you so much for participating in this important meeting today.
Oh my gosh, well, thank you so much for the introduction, Io, and for the invitation. We're really pleased for the opportunity to share a little bit more about Staten Island and SI COAD's story. So truly, thanks again for inviting us. Yeah, so National Preparedness Month, right? As we understand it, this national theme this year is ready for anything. And for us as a COAD, as a community-based organization and coalition, it resonates because we know being ready really does imply being ready before there is a need to respond, with the relationships in place, the routines in practice, and the resources, God willing, that make a difference when the crisis does hit. So SI COAD really exists to keep that readiness alive on the ground. And anything is a tall order, but we try. Our scope and service at SI COAD is borough-wide, which does present some fairly unique challenges to us and for us. We serve the entirety of Staten Island, but the mission at its core is pretty simple: to better prepare Staten Island's community orgs and providers for disasters and emergencies, and then in the if and when, to facilitate collective action. So we're not a direct response agency, and our host organization, our umbrella at Nonprofit Staten Island, is not a direct services agency. Our role is really to knit together the nonprofit sector, healthcare partners, government agencies, and other stakeholders, so that when something happens, we're kind of moving in cadence, moving in coordination together. I was asked to share a little bit about how we started. So here's the lore. Staten Island COAD, like many local, regional, New York City-based COADs and similar networks, was really born out of the days and weeks after Superstorm Sandy. Nonprofit leaders here in our borough saw and really felt how fragmented communication and coordination was. And so they built this coalition in real time to address that gap in real time. The coalition formalized under Nonprofit Staten Island, which was SIMFA at the time, to sustain preparedness year round. So as Sandy work really moved into the recovery phase, our borough happens to have a tremendously effective long-term recovery org. And so that handoff made a lot of sense for them to really sustain the work they were doing, helping impacted communities recover. And the COAD kind of pivoted its focus to education and communications, right? Really looking at those as anchor strategies to sustain preparedness at an organizational level for CBOs. This meant a real focus on situational awareness along the way, and led to pretty good exercises and opportunities for gap assessments. By 2016, so 4 years post Sandy, we established the Medical Ecosystem Subcommittee in our borough, and this was at the urging of our borough president, with a little bit of a help and heavy hand, perhaps from DOH. But Borough Hall had essentially convened sector providers, and forgive me, I didn't even start my timer. Don't let me talk too long about the lore. Convened some of the health providers, so our local hospitals, our senior care, our other clinical providers, to kind of do a little bit of a hot wash, though many years later, around this emergency response capacity of the sector. The Richmond Medical Society was kind of not active at the time or any longer, and so it really emerged that there was a need for forming some coalition for the health sector. SI COAD was an established coalition space for preparedness and communication, and we were really happy to streamline and adopt that subcommittee now, standing subcommittee, and begin to build a really important bridge between healthcare partners and nonprofit partners. Evolution, COVID changed everything, right? As it did on a global scale, indeed. Thank goodness we had the Medical Ecosystem Subcommittee. They were really able to step into the role that they were meant to serve and take leadership of the COAD, moving our work from situational awareness to operational coordination. And this was information routing, daily briefings, connecting mutual aid, uplifting the public health comms that were coming out, localizing that information, and it really did turn us into a bit more of a response entity. So since then, we've proceeded with that charge and tried to build a steadier state of readiness with our engaged members, with an expanded pool of stakeholders, and increasing seasonal drills and briefings, and just looking more seriously at data that's out there as far as hazards and threats go, but also our resources, our assets, and how we can kind of build awareness and shared preparedness. Looking ahead, of course, we try to keep doing that, improving on collaborative planning, and tying in subsector leaders and peer coalitions in kind of more impactful ways when it comes to our communications trees and real-time availability, or capacity, I should say. So how we stay ready, I mean, I think maybe the look ahead is a bit covering that ground, but I kind of put us in these three buckets. So infrastructure and governance, really critical to our coalition staying ready. We have an 11-member cross-sector steering committee, and that includes representation, of course, from our medical ecosystem, the Red Cross, our borough president's office, and a handful of CBOs. And that steering committee just stays really hands-on and really proactive in continuing to develop our living documents like comms plans, asset maps, scripts, contacts, all that good stuff. And we take really seriously the pursuit of kind of iterative improvement cycles. So really taking the time to reflect on what's working, what's not, tweaking our strategies, bringing new folks into the fold, bringing perspective, and then kind of trying again. And that really helps us stay ready because it gives us that opportunity to be agile and also practice what we believe are best practices and routines. Through that, or in order to really execute on that, we program, right? So we do biannually a hazard vulnerability assessment in our borough, which allows for the voices of local leaders and service providers, as well as our more official partners, if you will, at state and city government, to give voice to what they see as the real and pressing hazards facing Staten Island, and especially those for which we are underprepared. So interestingly, for example, a recent outcome has been winter storms, which are not overly talked about in preparedness spaces, it seems. But in our HVA process, we really surfaced all of these intersecting vulnerabilities between power outages, extreme temperatures, fall hazards, precipitation. And we were like, yeah, this is something we as a network have not particularly readied ourselves for. So that exercise gives us a great opportunity to refine our focus as we go along and look at those potentially overlapping hazards in order to deliver workshops, briefings, tools, templates that would be helpful to elevate the preparedness of our members and our community. And one of the strategies there would be our force multipliers. So those tools and templates, and we've been really keen on growing our evergreen content library, if you will, so that folks really have ready at hand tools and messaging and safety information that can go out into communities in the if and when. Of course, our institutional partners, our funders, are tremendous force multipliers for us and also feed into the information sharing that we're able to do. And just the one thing I do love to uplift here, we multiply our capacity by saying yes when opportunities come up. And I just love to encourage that when there are other nonprofits in the room, because capacity building is hard. But we had, for example, outreach from Columbia University with a group of student researchers who wanted to look at a climate project. That's a yes from us, and that's a capacity build, and that gave us new insights, new mapping tools, really cool data that we could use and uplift for a couple of years. That was a year ago, and I can still use it in a presentation and be like, that was capacity building. So we tried to be, again, really agile and pursue these iterative improvements, tapping into capacity when it comes our way. And then my quick spotlights here. With the extreme heat, like many other sends and coads around the city, this summer NYCM preseason activated us or engaged us in an exercise, and that shed really important light on our comms trees and our timing for feedback loops. That kind of fed into the ways we were able to respond better during advisories this year. So we really leaned into the strategies that were highlighted as what we could have done during the NYCM exercise and during our subsequent tabletop exercise. And that made us that much more effective when our partners were called on to distribute cooling towels and water at community events, to get cooling center and heap info like directly into the hands of residents who needed it, and amplifying the guidance that was coming from the city. So we had, I think, a much more successful summer because, again, those routines and relationships were in place and in practice pre-season. The pre-built assets from NYCM this year, just shout out, it helped for sure. More of that. And the local messengers are the key to everything, right? We are our membership. It is their credibility and relationships with community members, since we are not direct service providers, that really allows us to help keep our borough safe and kind of weather the storm, as it were. Grows, we've got areas. We do aim to improve our field feedback loop, and I've been mentioning that subsector leadership is a really important strategy there, as well as developing our language accessibility. little bit of a shortcoming, as it were, for our coalition. And then the second quick activation here was the late July flash flooding, where NYCM again called on partners um, to amplify some advisories pre and post event. And we were able to do that, engage through primarily email and social media with some phone calls along the way. The localized advisories and overlaying data was really helpful here. So we were able to like uplift travel safety, quick preparedness actions for home and basement safety, and then post-event advisories. But layering in, I gave us the snapshot because it just blew my mind when I saw it. We layered in FloodNet censored data, which on this intersection shows 22 inches of water in a single moment of that flash flood, and overlaying that with photos and stories coming in from our partners. That hyper local approach really mattered. We saw really improved, frankly, responsiveness after this. And also had some great takeaways where we thought about how do we build out some more evergreen content for after a flood. And again, those subsector leaders really, since we're borough wide, understanding who we can reach in particular neighborhoods when impact is so hyper localized is increasingly important. So what's next this year? We're looking to continue and really expand or deepen our engagement with NYCM, strengthening community partners serving in our borough. We see that as an important strategy for closing some gaps, frankly, on our own side. So things like that language access, disability and functional needs access, and then just in general, being able to plan for those call trees and points of contact at other orgs is really important to us. So we're doing some of that. Our leadership team stays really hands-on with the emergency comms plan. You'll see our outcomes for the HVA here on the top left. Our programming for the next year or so will focus in on those three areas of hazard: extreme temps, blizzards, and hurricanes. And so we'll be doing that both nonprofit facing and health sector facing as we continue to streamline the cadence of what the medical ecosystem subcommittee really looks like post-COVID. You know, it's been frankly a different world. So always grateful for the time with VOAD. If you're interested, I don't know, find us, hit me up. We're happy to have folks follow our listserv, follow us on socials, although admittedly we're a little more active when there's a call to be active. The long and short, I think, is that my top line bullet, when I thought about it, is just help us kind of continue to have voice. We so appreciate it. Staten Island as a borough doesn't always have its own seat at a citywide table. And so helping to keep our coalition visible in data collection efforts, in planning, in pilots that are rolling out from whether it's city partners or other stakeholders. We just appreciate anyone who says, hey, did you give SICOA a call? It really does go a long way. And then, of course, if you're in a position or interested in lending capacity in any way, host a workshop, join us for a tabletop, just get on the listserv so you can be one more person answering my call down drills. All of that is totally welcome. It helps us become stronger. Obviously, it helps our reach, and we appreciate the collaboration. So certainly the stronger we are locally here, the stronger the whole city can be. So thanks so much. I know I already said Q&A, happy to do it, but I know we've got a number of other folks, so you let me know.
Yeah, thank you so much, Michelle. That was really awesome. We are going to actually hang on to Q&A until all of the presenters have spoken. Um, so next we're going to have Bob Ponce. He is one of the co-founders of the Harlem Emergency Network, HEN, otherwise known as. It's a volunteer-driven emergency communications organization. It serves Harlem and Upper Manhattan. It focuses on preparing for, responding to, recovering from disasters, and ensuring that the community's resilience through collaboration with all kinds of local organizations and institutions, civic groups, houses of worship, businesses, and senior citizens. Very, very important. The Harlem Emergency Network bolsters grassroots emergency preparedness by leveraging local resources. And its mission is people-centered, people-first coordination, aiming to fill gaps, especially when government resources are stretched or missing during major emergencies. And Bob has, for his work, received many forms of recognition and awards. So, Bob, Thank you for being with us, and the floor is yours.
Okay, let me get the screen share going. And all right, there we go. Can you see the screen?
Yes, yes, we can.
Okay, great, great, great. So, as she said, we're Harlem Emergency Network, or HEN. We had one member. He was a little bit uh, misogynistic. He didn't like being called hen. He doesn't hang around with us anymore, though. So, but anyway, we've been around since 2012, 2013. We were formed. I'm going to give a hold on. Um, I Okay, there we go. So just a quick brief history of Harlem Emergency Network. We first of all, we our focus has always been about communications before, during, and after an emergency. And we were formed out of the radio station WHCR 90.3 FM, known as the Voice of Harlem, and we are part of City College. But it's the radio station is run by all volunteer hosts and producers. After Hurricane Sandy, our station manager recognized that the station was not really prepared to deal with emergencies adequately. And so she asked my co-founder, Wally Abdul Noor, who was kind of the station engineer at the time, to put together basically an emergency broadcast team for the station. And so that's where we started. And so Wally has had a long history in radio communications going back to when he was in the Navy. And he's also had been a part of the CERT team for some time. And so one of the first things he did was basically make us join CERT so that we could actually know something about emergency preparedness before we started putting the team together. Probably one of the wisest things he ever did, because the CERT training certainly gave us an eye-opening into what we did not know about emergencies in New York City. So from that grounding, we went to not only coming up with protocols for how the station would operate, but we also began to see that we really needed to have a community outreach. And because you really couldn't have community emergency preparedness without the community. And so one of the things we did early on was we started an event an annual event that's still going on now, which is Harlem Emergency Preparedness Day. And in that event, we started to partner with Harlem Hospital and the CERT teams, and we had great speakers who came up. One of the speakers at that first one we had was Carol Johnson, who I know you all know. And
Yay.
she she has continued to show at the time she showed us that she was the most prepared person we'd ever seen. Even with her mobility issues, it never stopped her from being prepared and letting people know that in an emergency she knew what to do. And so the other smart thing we did was made sure we got her on our team as early as possible. And so we've continued to just focus on emergencies and focus on, we still do other things. The picture you see is a Stop the Bleed event. And the right picture is a event we did last month called Building Resilient Communities. So we still get out and do different things. We do tabling, but we want to continue to keep our focus on communication. And with us, what we're saying, I, I I meant to start my timer. I'm thinking I'm hearing Michelle's voice in my ear saying, "Start the timer."
You're good. You're good.
Okay. So all community preparedness starts and ends with community communications. And you can't be prepared without number one, the communication about what preparedness means, but also the communications about how you are going to communicate when an emergency comes, and what are your first of all, you understanding how emergency communications is different from regular communications. In an emergency, communications need to be concise, they need to be clear, and they need to be from verifiable sources. And your network needs to be networked before an emergency. In other words, you need to know who you are talking to, you need to know how you're going to talk to them, and that needs to be part of your plan. And really, you need to understand that you have multiple platforms, and the reason for having multiple platforms is depending on the type of emergency and the severity of the emergency. You don't know what platforms are actually going to be up and running. And so we certainly saw this in 9/11. There was so much cell phone traffic after the towers fell that cell phone traffic was virtually impossible. However, text was available. And so, you could still text somebody, but you couldn't necessarily call. So that's, two different platforms there. We found out in Hurricane Sandy that, out in the far Rockaways, everything went down except for two-way handheld radios. There was no cell phone, there was no internet, there was no text. And so, in understanding that we have these different platforms, some that are more disaster resistant than others, we decided to build on multiple platforms and use as much as we can about modern technology when we can use it, but also have some of the good old-fashioned stuff like ham radio and two-way radio that can operate even when everything else is down. So I want to talk about cell phones because, even though it could go down, it's got multiple emergency usage. So you got your flashlight there, needed in an emergency. You got phone, you got text, you got a compass on there. You might not have looked at it. Most of us don't look at 90% of the things that are on our phone, but for emergency purposes, it's a good idea to check in and look at everything that you have on your phone. And so that includes two-way internet radio. We have a two-way internet radio network that we use on our cell phones. And that has been very, very useful for us. Number one, in terms of getting people trained in community emergency community protocols because everybody's got a cell phone, so we could onboard people right away and start to teach people the protocols without having to have them invest in a radio, and that's been very, very useful. And we've used it in practice too. We've actually had one of our members who at one point in time was stuck in a subway elevator, and he was able to reach the team, and we were able to contact first responders to go to that location, and also just keep him and the other occupants of that elevator calm until help arrived. So we've seen that it's very, very useful. And the other thing about two-way radio and communications in general, as I said, we have a protocol that is kind of call response. You can't both talk at the same time. It's just like the walkie-talkies that we grew up with. And so it's a call response. We generally have a network control operator, and then people call in. And we do radio checks every Monday morning for the last, I don't even know how many years we've been doing it. And it's very simple. It takes a minute or less, but we basically identify who we are, identify our location, that we're safe. And the thing about the protocol is that you say where you give the information, and the network control operator has to say it back to you so that we know that they have heard them correctly, so that in an emergency, the difference between 115th Street and 116th Street could be the difference between first responders getting there in time or too late. And so
Bob,
that we
I'm
try
going,
to,
I'm sorry to interrupt you mid-sentence because what you're saying is like critically, I mean, love the examples
Hmm.
that are very user-friendly, whether you're within an organization or not. But we do have to move on to other presenters. So I'm going to give you 1 minute to wrap this part up, but then we're going to ask everybody to put their contact information, all the presenters in the chat so people can also follow up with you. But um, but continue,
Okay,
and
so I've got a
thank you.
minute. Okay, all
Yes,
right.
sir.
So, all right. So one more thing about the iPhone that you may or may not be aware is that in an emergency, when you have no cell phone or Wi-Fi service, you can actually connect to satellite. And this is a feature
Hmm.
that most people don't know, but it's in your iPhone. I'm not going to go through the demo that I thought I would, but I can send this deck out to somebody if they want to. But you go to your control center and it has a place where you can try the satellite demo. So I recommend that everybody go on, find that, and try the satellite demo so that if you're ever stuck somewhere where you have no cell service, you're mountain climbing somewhere and you're in trouble, you can actually use your iPhone to get to a satellite. Um, I was going to
Amazing.
give a demo about how to use AI to create kind of a survival notebook, but I don't think I have time to do that demo. But if we have time during the Q&A, I can come back and do that.
All
Uh,
right.
we have
Sounds
some upcoming events. We are actually doing an emergency training on Saturday, September 20th. There is a QR code there where you can register, or you can send an email to Harlem Emergency Network at gmail.com if you want to register. We are also having our Harlem Emergency Preparedness Day on Thursday, September 25th from 12 noon to 5 p.m. That's on the City College campus. It's great place to get more information. And the East Harlem COAD is also having their Readiness Day on Saturday, September 27th. So that's my presentation, and I'm glad to come back later and answer any questions.
perfect, Bob. Thank you so much. Definitely would like to try that demo and share all of that information
Mhm.
with our coalition. I don't think many people know that. Um, and now we're going to move on to a representative from NYSEM also. NYSEM's liaison to our organization, New York City VOAD, Dana Nelson. Thank you for being with us. Dana is the program manager for NYSEM's Human Services Plans. And in case you don't know what that department does, um, they actually plan and coordinate city resources to meet the human needs of New Yorkers that are affected by disaster. They focus on mass care services like feeding, sheltering, including, very importantly, pets, donations, management, and support for vulnerable populations with access and functional needs. And they achieve this by building, as we all do, partnerships with public agencies, nonprofit organizations, and helping to develop plans for disaster response and recovery, and kind of conducting training to prepare these partners to effectively support communities in emergencies. So I am going to let her talk about her unit and NYSEM's relationship to mutual aid, COADs, and emergency networks that are community based in New York City. Dana, welcome.
Thank you. Thank you guys for having me. Thank you for allowing me to speak. My computer, for some reason, the headphones does not play well with uh it does not play well with the audio. So I'm on my phone and also on my computer. Also, as just a house cleaning thing, I am very self conscious with being on camera. So I tend not to be on camera. It just, I can't focus. It does not do me well. So I will be off camera while I'm giving this presentation, but I did want to show my face so that everyone can be familiar with me. I know a lot of you guys have worked a lot with you in the past, which I'll get into in a little bit, but just wanted to, turn my camera on really quickly and just say hello, but I will be doing most of the presentation off
And we
camera.
are happy that you did.
Thank you. Um, So, with that being said, I do want to give just a little bit of my background, my personal background to coads and this relationship because I have been in this space since after Superstorm Sandy. I worked very closely with the Brooklyn Long-Term Recovery Group. I was on the board, a board member for the Brooklyn Long-Term Recovery Group, and I was a co-chair of the DCM. The Disaster Case Management Committee subcommittee on the Brooklyn Long-Term Recovery Group. We came up with plans and protocols in place to help while we had, everyone know NIDIS did that large kind of roundtable in Brooklyn, and we had the Brooklyn Long-Term Recovery Group, which is kind of, it's like own little niche COAD kind of set up in response to recovery to Superstorm Sandy. We set up a kind of quasi roundtable of ourselves what had to do mainly to do with repairs, getting clients to be able to go out. We worked with Resurrection Brooklyn. We worked with All Hands. We worked with a number of construction-based organizations, and we came up and planned a plan and created a policy with DCMs. We would vet the cases. We would look at the cases and say this would be a good case to present to this roundtable, this construction roundtable, and have them pick and say, we can do the flooring, we can do the roofing. And we were responsible for a number, I want to say almost 100 homes being receiving some level of repairs. And so that was part of my first introduction to not only the disaster realm, because Superstorm Sandy, we know, is a lot of people got introduced to this realm of emergency management and recovery, but it was working, my first time really working directly with a network of people that work so cohesively to get just one individual back to a space of some kind of normalcy. And so I enjoyed that work tremendously. I've created a lot of relationships with Salvation Army to Red Cross to, DOH. A lot of us have moved around in this space. And so it is good to kind of return to this space as emergency management and to be able to see it at the 30-foot view. And I want to say thank you to all of the works that happens closer to the ground, directly with the public and directly with the network. So thank you for that. And thank you for allowing me to be in this space to be able to give the information today on behalf of NYC. And so, with that being said, I work mostly closely with the VOADs, with the plans for service center liaisons, helping the VOADs connect with city resources, works with COADs, and things closer are done by Mariah Washington and Jill Cornell in our community engagement unit. Unfortunately, they weren't able to, due to prior engagements, they weren't able to make today's call. So a lot of the information that I am giving would be on behalf of their units because they're the ones that work really closely with the COADs. And so I kind of stepped in and say, I join the VOAD meetings regularly, and I'm more than happy to give this information. I want to preface it that way because while they gave me all the notes and I am knowledgeable, I cannot answer like all of the nitty gritty, like get into the weeds kind of questions, but I will be, if there are any. And so, but I will be able to kind of take notes and get that information back to them in that realm. Okay, so to start and to give a history of the evolution of the New York City emergency management relationship, and is my screen showing? Because I want to show this.
Not yet. Not yet.
Okay, let me. Do we have it?
It's coming now. There it is. We see it.
Great. Okay, so the evolution of our relationship with COADs. In the aftermath of Superstorm Sandy, NYSM kind of reached out to the COADs that were active at the time in ways that we can improve the partnerships with the community organizations. The 5 community organizations that were in operation at that time was East Harlem COAD, South Brooklyn COAD, Staten Island COAD, LES Ready, and Far Rockaway Arbor nonprofit. And at that time, he is now our deputy commissioner, but at the time he was assistant commissioner, Herman Schaefer. He created what was considered the Community Emergency Planning Toolkit to better connect New York City resources and communities. During the research phase with the coexisting COADs, they were consulted on the best way to build out this toolkit. The purpose of the toolkit is to create like this boot camp training and this is the page that you can go to and join and get more information and resources. There's a number of resources here. There's training resources, stay informed, and how to connect with NYSM in this community. I can put the link in the chat. It tells how to be able to join and plan out the toolkits. The toolkit is mainly specific for a network of groups. It helps with guidance of creating an emergency plan. It helps with putting together resources and having your information all in one space, right? It is for tenant association, faith-based organizations, CERT, community-based organizations, and different. It's mainly geared towards groups and not individuals. And it's how the group can come together to strengthen their relationship with the community around preparedness and emergency management planning. Okay. Once the toolkit was kind of updated, then they created what was the boot camp training. And so the boot camp training, again, is to teach these networks how to train and engage with their community around preparedness and community information. Thereafter, after COVID, there was a number of funding that kind of came into NYSM around the creation of the Strengthening Community Program. The Strengthening Community Program provides small grants to community engagement networks, and let me kind of jump to that page. So it was launched to create for small community engagement networks and COADs to establish their own hyper-local emergency plans. The integration of the community engagement network is critical as there are a number of networks who are already working together cohesively with a common mission, such as climate justice, housing rights, education, but they need to make a commitment to be a part of an established culture of emergency management preparedness and local community emergency strength and response plans. And so this kind of helps to build out and design maps, build a directory of resources, and kind of solidify and have funding around building out some of these resources that would be available, right? The examples that were given for how this has worked in the past is that in cohorts 1 and 2, which were trained and given resources around 2023, they were able to be activated and do certain exercises such as the heat activation, the flooding that happened. And so this was kind of launched. And so some of those responses were how they received the funding and planning and training that went along with that. And so once an activation or a preparedness strategy is in place, we have seen those cohorts kind of went through those kind of emergencies and activations successfully. During the activations, the group were asked to amplify safety messages. They were asked to report back impacts in their neighborhood. And then us at NYSM, we were able to compile that data and see the impact of our partners and help with our day-to-day planning when it came to the activations. We continue to innovate the program, and we have co-presentations on topic ranges from air quality, heat safety, earthquake, flooding. We support resiliencies with the City of Water Day events, as well as National Preparedness Month events, and the materials, and by providing materials and staff. Current ways NYSM support the co-rise across the city is that we continue to provide training and support for the Ready New York programs, community preparedness training options, CERT volunteers. We ensure the funding is made available for the strengthened community sustainability programs that allows programs for funding beyond the initial year of training and to continue to fund their programs throughout the following year. Again, we have these pages are here to provide you resources, provide you information. We suggest that you go to these pages or reach out to our community engagement unit, either through Maharaya or Jill Cornell, which a lot of you guys already know, or you can click through and request to be contacted on this page. Any additional questions I can take after when we get to the Q&A.
Very excellent. And thank you so much, Dana. Much appreciated. And for our final speaker from the Department of Health and Mental Hygiene, I'm pretty sure everyone knows, and that is Lou Rivera. Lou is the Director of Community Engagement and Response Unit at the New York City Department of Health. And in this role, he oversees several critical projects, including the Community Preparedness Program, the Community Resilience Planning Committee, and the integration of community engagement response strategies and key partners into the DOH-MH's incident command structure. Lou is dedicated to ensuring that community voices are prioritized in emergency response efforts and apparently everything else that he has done in his professional health career. He has managed programs in both government and nonprofit sectors, healthcare services, education, and he initiated his professional journey focused on reducing HIV infection rates in communities that were disproportionately affected during the AIDS crisis, particularly among LGBTQ plus and BIPOC population, and is very important and key person in the development of city agency supports for organizations such as yours and such as New York City VOAD. So it is with great pleasure that we once again welcome Lou Rivera to New York City VOAD. Thank you, Lou.
Thank you, Io, for that introduction. And I would add that for me, while I'm trying to, can you see my slide deck?
Not yet.
Let's see.
It is probably not seeing it buffering yet. Well, we know that you have memorized every single thing that you wanted to
Yeah,
say.
right. Let's see.
Not yet. But there it is. It's
There it
coming
is.
now.
Okay. And then let me just,
We can see it.
you can see it, and then let me just do this. Okay. Well, first and foremost, thank you, Io, for that introduction. Sorry with the technical difficulty with this system that we're using today. I'm so used to Microsoft Teams. I want to add that all the work that my unit has been able to do, certainly I did not do it in a vacuum. I did not do it alone. A lot of the credit has to go to people on my team like Hannah Annette, Elise Morris, and some of the people that were there before and no longer with us, like Alana Tornello, also Eddie Pierre. So I just want to acknowledge that the program that we have and the many things that we've been able to do over the years really was a team effort. So thank you for that, though. Just some quick keywords, and so you understand our language as I'm going through this is we are located in the Office of Emergency Preparedness and Response at the Health Department. We're in the Bureau of Healthcare and Community Readiness, and my team sits in the Community Engagement and Response Unit. We have a sector-based approach program, which we call the Community Preparedness Program. And though that sector-based approach focuses in on the human services, faith sector, and community leadership sector, within the community leadership sector, we support community emergency networks, as Io discussed, that those can be COADs, long-term recovery groups, et cetera, et cetera. We also work according to the Center for Disease Control's Public Health Emergency Preparedness Capabilities, or the 15 FEP capabilities. We do a lot of our work within community preparedness and community recovery. A lot of the activities and deliverables that we have with our contracted partners are based on those community preparedness and community recovery FEP capabilities. Also, you'll hear me talk about some of the work we've been doing over the past year, partnering with our healthcare coalitions who are actually funded through the Assistant Secretary of Preparedness and Response, or ASPR, through the Hospital Preparedness Program. So that said, I'll move forward to the next slide. Just to kind of give you a sense of who we are and what we do, we have 3 focus areas. We have our sector-based approach, as I spoke about earlier, which Elise Morris leads for the team. We have, and they provide oversight to 7 contracts across 3 sectors. So in the human services sector, we're currently partnering with Human Services Council In the faith sector, we're currently partnering with NIDIS. And then in the community leadership sector, we have 5 contracts in place with LES Ready. Those are these community emergency networks that both Io and I mentioned. So we coordinate with LES Ready, Staten Island COAD, East Harlem COAD, Far Rockaway Auburn Nonprofit Coalition, and Southern Brooklyn COAD. As mentioned, Hannah also is leading our capacity building work, and that really focuses in on the Community Resilience Planning Collaborative. She's also working to see if we can execute a national work group of community engagement SMEs in government that are focused on community engagement and emergency preparedness. So stay tuned for some of that in the future. She serves as SME not only to community members or community groups, but also to our DOHMH colleagues to help them understand the emergency management landscape and how to connect their programs and partners into that landscape. She's our representative for the DOHMH New York City VOAD. For the New York City VOAD. And she serves as a liaison with many other city agencies to inform them of our work and to connect them into our work and back to our partners. Eddie Pierre actually oversees the community operations focus, which that really is to integrate community partners into the community engagement branch, which is our formal structure we use when we're activated for an emergency. And then also we're doing some work around what does it look like to assist communities during the recovery phase of disaster and working to advocate for leadership to adopt a community recovery framework. So stay tuned for some of that as well. We've been working on this for a while, but it takes time in government to get some of these things adopted and approved. So, but we are moving along with that work. So that said, just, like, why do we do this work? Because at the end of the day, partnering with community partners really just enriches preparedness and response at the government level, right? Like, there's no way that the government can meet the needs of the community without having some of these key partners in place. And I say this all the time. Really, community partners serve as, subject matter expertise in partner engagement, right? To really figuring out what would be the best approach to engage the community, to engage with community and faith-based organizations. They increase the reach of government to the community, right? They're also trusted sources of, trusted people in the community, trusted relationship builders, trusted communicators, and they also provide bidirectional communication, between community and up to government. And these are all things that are needed to help communities prepare for and respond to emergencies. And government cannot do that without community partners. So, that said, obviously you see the logos of each of our contracted community partners that we engage with. I'm sorry. So, just to give you some history on why we do this work and how we came about doing this, some of this came out of Hurricane Sandy during the aftermath of Hurricane Sandy, but a lot of it also came out of following the September 11th attacks. It really became clear it really became clear that public health is vital to local and state preparedness. As I mentioned, the CDC established their 15 public health emergency preparedness capabilities. In 2016, we established our community preparedness program, and we piloted a project with the human services and faith sector and began providing where we worked with them to assess community preparedness across those sectors. And then we also began to work with them to employ emergency management preparedness practices and exercises. So developing continuity of operations, or COOP plans for the sector, emergency preparedness plans for the sector, emergency exercising, communications exercising and drills. So really taking emergency management and preparedness practices and working with our contracted partners to do a lot of those deliverables and preparedness activities that you would do if you were with, coordinating emergency management and preparedness activities during a response. Also, we began to really look, and we heard from from our partners about the fact that they didn't fully understand all the city agencies' roles in emergencies, who's responsible for what. So we worked with NYCM to do a lot of SIMS training. We implemented a lot of this into our community resilience planning collaborative, really to help our community partners, our contracted community partners, and their coalitions understand how the city operates during emergencies. So a lot of this came out of the initial phase of our community preparedness program, and then also through our community resilience planning collaborative, which Hannah leads. And also, while we had some working relationships with community emergency networks in 2016, it was really through the expertise of Hannah and Alana Arnett that had a real strong understanding on how these SENs operated, and brought them even more, into the work that we were all doing at the health department. So I would recognize that as well. Also advocating to get funding out to the SEND. So in 2018, we began supporting emergency networks in Staten Island, East Harlem, South Brooklyn, Lower East Side, and Far Rockaway. We had a pilot project, and then we went to giving long-term funding. Since we've started the program, we've allocated about $2.7 million to the human services sector, faith sector, and community leadership sector. While I wish we had more to give, when you look at it this way, it's something that at least we were able to support long term and keep this work going for the years that it has been going. And in my thoughts, allowing some of the community emergency networks and other organizations to actually have the time to carve out the work that needs to be done to connect back into city government during emergencies. As I mentioned, we did this based on CDC's public health emergency preparedness and response capabilities. There's 11 sectors. In the 11 sectors, the health department is in the mental health, behavioral health sector, the healthcare sector, and then also we're in the community leadership sector, human services sector, and faith sector. Let's also talk about community partners supporting public health emergency response, right? So this is really, at the end of the day, all of the preparedness work really leads to where we want to be at during emergency response, is really to have these contracted partners and their coalitions working side by side with the health department during a public health emergency response. And we have seen some of this occur over the years. In 2017, we began building out our community partner engagement unit to integrate into our incident command structure. And what we've seen with that was, while community partners always engaged with the health department over all these public health emergencies from H1N1 in 2009, there was more of a formal approach to doing this with community partners in the measles activation in 2019. So the ones that are starred are where we have this formal relationship between community partners and our ICS structure. So we did this for the measles activation, obviously for the COVID-19 activation, and then also for our Mpox activation. Some of the things that response efforts that community partners engaged with us on and assisted the health department in was they partnered with us, in the community engagement response group. They helped us to develop and amplify public health emergency messaging. They supported tailored engagement. They helped to canvass in COVID-19 and Mpox. They assisted with vaccine distribution. They participated in the Emergency Partner Engagement Council, EPIC, we call it. They also participated, many of you participated in the advisory board. They helped to inform after action reports, and they provided guidance on city, state, and federal evolving public health and contracting regulations to community and faith-based organizations. One of the things that we like to take some pride in is during the measles activation, we coordinated with an Orthodox, a Jewish Orthodox community group of nurses to develop this magazine called A Slice of Pie, which was really done to kind of address the misinformation that was coming out from a magazine that was called Peach, which was an anti-vaccine magazine. So that's one example of some of the work that we've done, but we have many examples. Also, we've been able to put this annual SEN conference together, and we had our first annual SEN conference this year in person. And so we take pride in that, and I know the Sens take pride in that. And so you see this picture here, empowering communities with practical tools for disasters. Um, and just to kind of give you an idea of some future preparedness and response planning things that we're doing, we will have new CPP contracts for the human services and faith sectors late 2025, hopefully. We have a new request for proposal to support hyperlocal preparedness through the community leadership sector for SENS. That will come out in 2026, sometime in 2026. And with that, we hope to expand to a SEN within the Bronx. We're continuing to build partnerships between DOHMH contracted community emergency networks and the healthcare borough coalitions that I spoke about earlier that is through the hospital preparedness program. We also are moving to hosting CER preparedness activities in person. So the Community Resilience Planning Collaborative is going back to being in person. Here's a plug for the CRPC. We have our first meeting September 25th, 2025. And that first meeting will be at Gotham, which is our headquarters for the Department of Health and Mental Hygiene in Long Island City. We're also looking to see how we include our contracted partners in emergency exercising with our bureau. We're looking to integrate our contracted partners into the newly designed ICS Community Engagement Branch. So you'll hear more about that. And then also contracting. So we're also looking to see how we have contracts in place for emergency response with community partners before an emergency happens. So there's some work happening around emergency procurements for emergency contracts for community partners. We're going to be doing this at a macro and micro level. So at a sector-based approach and then at the hyperlocal level. And so as we're continuing to build out what this can look like, we will inform you more about this. The important piece is to try to have contracts in place so that when we're asking community partners that we work with day to day to assist in a response, that we're able to compensate them for their time and effort that they're assisting the health department during a public health emergency response. So that's it. I hope I came in on time.
We could be listening to you, for many, many more hours. Thank you so much, Lou. Your presentation brought back so much history from the first meetings that were held out Cortlandt Street, the slice of pie, Epic, all of those things that were so much a part of the support and development of community emergency networks across New York City. So thank you very much, not just for sharing your presentation, but for all of the work that your agency kind of spearheaded in many ways to get support from city agencies and bring us all together. So thank you so much. Each of our presenters, thank you for your great presentations. I'm gonna ask that we will take a few questions, but first I'm going to ask everybody, please, if you haven't already, put your name, contact information, and affiliation into the chat. And so each of our presenters has talked about how they established their partners, their programs, their events, some of the tools of the trade, all of those kinds of things. And that is great. But right now, I think we want to take an invasive, very invasive, deeper dive into each of our presenters personally. Don't be scared. We just want to know. You talked about your organization, but what about you? Why is it? Why is it that each of you runs towards disaster and not away from it? Please take a minute to answer that question. And we'll start with Bob.
Okay, why do I run toward disaster? I don't think I run toward disaster, but I have been known to be around when they happened. I was on the corner of Wall Street and Broadway when the first tower fell on 9/11. And that I would have to say that kind of marked me. It's one of those events that you live to be 100 and forget everything else. I would never forget that day because just the sight of seeing the Trade Center with a big hole in it burning, and then that was at that point was the biggest, most shocking thing I'd ever seen. And then a few seconds later, when it all fell down, that was more shocking. And so I was in shock for about 10 or 15 seconds. And then I realized that there were a bunch of people running my way, and maybe I should either get out of the way or run with them. And first I chose the former, then I chose the latter when I realized that there was a big cloud of dust and smoke coming. It looked like one of the Indiana Jones movies where it's just thing coming at you and you had to run to get away from it. So I ran into a building with about 70 or 80 people, and we huddled in the basement, and then came out a couple of hours later, and just, the devastation. So that was, several years before I ended up on the radio at WHCR. And when our station manager gave us the call, it said we weren't really prepared for this emergency. I got involved, and once I got on the CERT team, I kind of went down the rabbit hole on it, and so I'm still I'm still in the rabbit hole.
That is a very moving explanation, and thank you for sharing it with us. Mr. Rivera, you are the next person that we would like to know why you have been running towards disaster, apparently for decades. Why?
Thank you, Io. Well, I am a native New Yorker and a 70s child, and I grew up in the city at a time where it wasn't as fancy as it is and as, I guess gentrified as it is now. And so when I think back of what started me on this journey, was just the fact that I had to learn quickly how to advocate for resources, for myself, for my community, for my church that I was involved with at the time. I also grew up in a time of the HIV pandemic and the crack epidemic here in New York City, and so anyone who lived through that in New York City really knows how how much we were dealing with in the city at that time and how much of an emergency that was. Although federal government and probably even local government wasn't looking at it in the eyes of an emergency in the ways that many of us had to live through that. So that has always been the sort of the driving force behind me and the work that I do. Is just I've had a lot of memory. I had a lot of family members pass away of HIV at an early age, in my family, and so it's something that has stood with me in my entirety, and it's why I do the things I do. It's why I believe in the work that we do. I would also add that I have some really good staff that keep me on my toes and keep me well informed. And if I'm not doing what they think I need to be doing, I am reminded of that. So, thank you to Hannah, thank you to Elise, Alana, who used to be on the team. You know, um,
Amazing person.
they are great, to have on the team because they really do have their ear to the ground in coordinating with you all. And so, my job is about, uplifting the needs that you all have. So that's what really keeps me. But it's my early experience in the HIV and crack epidemic of New York City and growing up at that time here that that keeps me going and makes me understand like we need to make sure the communities have what they need.
Thank you. And you do have an amazing team of all of those names that you recognize and that we work with. And thank you for sharing your story. And Michelle, you are here somewhere, I believe, but I do not see her. Okay, we're going to move over unless we and try to find her after to Miss Nelson. I know that you had an excuse before for not showing your face, but now that you are not sharing your screen, we would love to see you. But if not, there you are. And please, I think you've explained a little bit about it, but from a
Yeah.
personal perspective, why
Yeah.
do you run towards a disaster?
So I don't know, but let me let me give you.
Okay.
um, so I'm a lawyer by trade. I'm fully licensed to practice law in New York. I'm also fully licensed to practice in New Jersey, but I kind of let that lapse because maintenance is just got too expensive. But I am licensed in 2 states. So I always, since I was 8 years old, I always thought I was going to be a lawyer, and I am a lawyer for more intense for all intents and purposes. And when I was in college, I had my son fairly young. I was in my 20s, but it was still young 20s. And so I was working part time and going to college and finishing out my degree at John Jay College of Criminal Justice. And my mentor at the time, she was like, "Hey, I got this job for you, and it's working in home finding and foster care." And I'm like, "Foster care?" I was like, "I'm gonna be a big time lawyer. There's no way. I don't need a foster care job." And she said, "You have a kid. It's a full-time job. Just take it until you kind of get to law school." And I said, "Okay, no problem." And so I ended up doing that for 6 years, almost 10 years. And it was hard. It was challenging. It wears on your soul. But I've made some great placements. I've worked with teaching foster parents how to care for foster children. I've worked with, the most difficult population in foster care, they said, is kinship care. It's because you're going in to tell a grandmother how to take care of their grandchild. But I liked it. I loved it. I was, primarily worked with kinship care. And so I had this case management, working with people kind of background, and worked in it for over 6 years. And then I said, okay, no, it's time to really go to law school. Like, this is enough. And my dad was like, I thought she was going to be a lawyer. So everyone was asking me about, like, what happened to this law school stuff. So I said, okay, I'm going to leave that behind. I'm going to go to law school, which I did, finished law school, finished out, and started to kind of work in the industry. But, 2008 happened in that time. The market wasn't great. And so while I had positions, I had been let go, and it was difficult to find a job right in the way that I needed to find a job. And then Superstorm Sandy happened, and a friend of mine was working for Catholic Charities, and she said, "Hey, we're in need of volunteers. I know you have this background. Can you come out and help, and help with the volunteer and help with the case management stuff? They'll pay you too." So I said, okay, no problem. And so I gave my resume in, and they said, "We see your resume. We would like you to be the supervisor of," and it was the quote unquote restoration center in Coney Island. And I'm sorry, it was Gravesend. It was in Gravesend. And so again, got into it, loved it. It was dynamic. I was working directly with the public. We were in it, doing that work, and it kind of opened my eyes to the great work we can do in the community while helping people recover. And so I ended up staying with Catholic Charities. Almost, I think I left. I started in 2012 and I left in 2018. So again, another 6 years in that industry. And it was just like, I could go look for a law job, but also here's like New York City Emergency Management, and we can continue. And I was, like, again, doing the Brooklyn Long-Term Recovery Group, and I was doing case management. I was the, I was the co-chair of the DCM committee, and we were going around the city being advocates and working, and just, working directly with the public and helping people recover and helping people to put their lives back together. And it just, all throughout the whole thing, it just felt so continuous and rewarding. And so it was just like a natural progression of being here in emergency management and human services. Of emergency management, I think we work more directly with the program more than any other unit. And so even though we're not like doing the great work that you guys are doing on an everyday basis, when there is emergencies, we do go out. We are able to set up, my plan is the service center plan. And that's where we set up that one-stop shop where a person can come and get all the services they need in one location. And I manage that plan. I try to make that plan as effective as possible, make sure we have the right partners in the room, make sure we have the right relationships to get individuals the help that they need. And I've worked at the one of the most difficult ones was the Twin Parks fires, where 17 people died, and I was on the ground. It was such difficult work. It was so hard, but I felt like we really truly made a difference to a lot of those individuals that was there and that was going through it. And so I think just continuing those really like that feeding that part of my soul while doing this work has been great for me. Eventually, like I'm trying right now to get back into law. Like I'm working right now with our legal unit in emergency management.
You would be amazing. And if you have any particular industry target populations that you want to represent, please give me a call because I've got a
Yeah.
lot. I've got a
Yes.
lot.
So this year I have made my commitment to kind of, I'm working closely with our legal unit to kind of veer back into the law side of things and trying to sharpen back my legal skills back to where they used to be, so that I can kind of like, again, I'm paying this loan back, so I have to do something with the degree. But I did, but I do enjoy it. The reason why it's taken me so long is because I do enjoy this work a lot. I really do. I really do. It's
Perfect.
so that's my story.
Well, thank you. Thank you for sharing it with us. And I think Michelle is not here. But I do see if you have time we have two questions and we're a little bit over, but this has really been fascinating and appreciated. So I think Shayna, our treasurer, has a question, and then there is one I'll find it after Shayna asked her question. Shayna? Um,
Hi.
Hi, Shayna.
Hi, all. I mean, this was a really great get together and presentation. Thanks to the leadership team for putting this all together. The outreach and everything was really informative. I think one of the questions that I came away with was really for all of the presenters. It's around funding, just being that much of the work that everyone spoke about today is not necessarily direct service, but more so around the vital work of organizing. What funding resources should we, the VOAD group, New York City VOAD, look to for support as we're looking to build capacity and expand our reach? Being that our work too is similar in the sense that we organize and disseminate information during disaster around preparedness.
And that is for anyone to answer, maybe one or two of you.
Yeah, for anyone.
I don't have a real answer to that, but that's the question that's on everybody's mind. Certainly, um, I am going forward, or I would say we are going forward with the expectation that Washington, D.C. for the next few years is not going to be particularly involved in funding emergency preparedness. I mean, you've already seen what they've done to FEMA, so expecting that there's going to be a lot of downstream funding for, local groups or even state and local municipalities is, I think is unlikely. So we're certainly looking at other options, looking at how we can get more support directly from our community. But I don't have any answers other than, we all have to share in that question right now. But I think we're dealing with a new reality and we shouldn't sugarcoat it.
Thank you. Thank
Thank
you
you.
both for the question and the answer. We have another question, and that is Roger still on? Uh, if he is not, his question revolves around mobilization. And he wants to know how NYSM in particular calls for volunteers before, during, and after a disaster. And before that is answered by Dina, I just want to remind, well, not remind, but let folks know that, it was an uphill battle partnering with these agencies. But one of the first things that NYSM did that was out of pocket for them because NYSM is the agency that actually heads, and puts together recovery centers and makes all those decisions and has their contracted partners like the American Red Cross or New York Cares, organizations with whom they have big contracts to provide a service at the site along with their agency members. And when we had the East Village apartment collapse, it was the first time after building that relationship through DOHMH and NYSM early on that allowed LES Ready, the organization who best knew our community and schools and many of the people who were affected by that, to actually assist at a recovery center. So there's a lot of history with all of these organizations and agencies. That's just an example of how powerful a partnership with a community emergency network can be. And that question is for you, Dina, around mobilization and volunteers, if you can answer that.
I can slightly answer, but I did see Lou have his hand up. So Lou, did you want to
Oh,
touch on something before
okay.
we?
Sure.
I just put it in the chat. I was gonna say I agree with Bob, like we're not sure what government funding is gonna look like in the future. So that said, if there are opportunities to secure private sector funding, like you guys should all be exploring the private sector funding landscape here in New York City, to see if you could apply for private funding. So I know it's something also we've been internally discussing as well. And but that said, that would be an option. And also I would add, like for the VOAD, like we'll talk more about some of the stuff I'm doing around emergency contracting, but clearly sort of defining the role of VOAD during an emergency response. And then I can make the argument, like I think people like me and Herman, whoever has any voice at the table to secure funding for community partners at our government agencies could make the argument as to why, we need to fund a group like the VOAD, right? I know why, but I need to be able to articulate it. So you guys helping me articulate that would be helpful.
Yeah. And just to piggyback a little bit off of that, some of the news that we've kind of received on the scaling back of FEMA, where they're looking more to, when it comes to setting up things like, I'm going to speak to service centers and recovery centers because that's kind of my thing that I have a purview on. But I'm sure it goes across the board, but they're going to be scaling back on deploying for disaster recovery centers, right? And so now they're looking more towards the local city government to kind of be the person to stand up, because in the past, once a declaration is decided, FEMA would step in and we would scale back. And so they're letting us know that that's no longer going to be the case. There's, they're going to deploy people to information and do that kind of registration, but they're not going to have the large footprint that they have anymore. So we're going to be either stood up our own service centers and local centers a lot longer and require a lot more staffing for a longer period of time. And so we're going to cross some of those bridges as we get there, but we have to kind of fortify and plan for that. And then, also speak with you guys about what that looks like in response of having your agencies there for a longer period of time, or more resources that kind of comes along with that. With funding, I know it's very difficult. The most that we can say is that when, my unit, we're in particular, we know about funding time up when the disaster happens. So if we have that relationship to say, here is how you get the case management, be part of the case management program and reimbursement through that. Here's how there's resources. This is the best food. This is the best agency that we use for food. This is how we kind of put you guys in information to say, here's the grants, here's the money that's available, here's what's available behind in a particular emergency. But during blue skies and during regular, I know there's a lot of upkeep that has to go with VOAD. I know there's a lot of things that you guys, the meetings and all of these things cost, but there is just not that general everyday funding. The most that we can do is put our best foot forward with our partners, put them up and let you guys know when these grants are available and help you kind of work through some of that stuff when it does happen. So that is funding question. And now moving on to volunteers, I can speak a little bit towards it. Again, I'm new to the volunteer side of this. I know Herman and his team have the volunteer task group, and it is New York Cares. It is a group of individuals that work closely with volunteers and having them deployed and having them have the right skills, right resources, vetting them, making sure they have a place to stay, making sure all of that happens. I know there is if there is a request that usually goes out through this group. I can't tell you exactly who the partners are, but I know New York Cares is the lead agency for it, and NYC is the supporting agency for it. Part of the thing that I'm going to work on to stand up is the reception center for volunteers, so that we have a good cohesive plan in place for when volunteers do come in for a particular disaster or come into the city, period, and making sure that those resources are available and there is coordination between the groups that will be able to house them, vet them, and go through. To speak to directly how that information goes out, I can bring it back to Herman and Jill and Mariah and their group to say, hey, Voad wants to have a particular know-how, and we can try to get that information over to you. But I know that is the main conduit for volunteers to come in and be placed in the city, is that volunteer task group. We do have spontaneous volunteers that say pop up and say, hey, we would like to volunteer. But even if that happens, we still would put them, to be part of a particular group. We would still push them towards a particular entity that does manage and vet volunteers.
Perfect. Perfect. And I think we've come to just about the end of our program. Again, want to thank everybody who attended, all of our great presenters. This really speaks to the power of not just preparedness, but partnerships and also being informed. If you do not have the information, you cannot do anything with it. I want to also thank our Vice Chair, Zach, who repeatedly puts up with my lack of technical inability. Thank you, Zach. And we will see you all next time. If you have any events or anything for Preparedness Month still, and you can forward it to our New York City VOAD email. We'll share that information. And lastly, for the presenters, if you can please send us your decks, we would very much appreciate it. Again, you can send that to the New York City VOAD at gmail.com. And that said, everybody have a purposeful day and take good care.
I uploaded my deck to the chat, so
Okay.
if you guys want to
Okay.
grab that, it's right there
Okay.
And
Thank you so much.
somewhere in there.
And Io,
That's
do we want to just
Sure.
add for the board of directors meeting that's supposed to follow? I think maybe we'll take a mini break before what do you think?
Sure. We can take a 5-minute break and the board members can convene at 11:35.